picture must bring you some memories. Well, from modest gains made towards achieving our 2030 target of completely eliminating HIV/AIDS from Ghana, recent results seem to be a setback. HIV prevalence in Ghana continues to climb, an issue of significant worry to policymakers and the Ghanaian society at large. Current figures show a sharp rise and new infections that is mainly happening among females. Those are the figures over the last 5 years. Very worrying indeed. There are efforts to reverse the trend and take Ghana back on track to achieving the 2030 target of total elimination. We've been taking a look at the situation in this documentary put together by my colleague Prince Apia. It is titled Pills and Herbs.
In this documentary, I'll be speaking to some persons living with HIV and herbalists who claim to have a cure for the disease. I find out how stigma pushes these people to avoid taking the very drugs that can make them live longer. Meet Jane, a 34-year-old trader, married with 2 children. This place provides her the calmness anytime she wants to reflect on her life. She made a promise to herself as a young girl to keep her virginity till she gets married. But the struggles of life compelled her to break this promise when her mom got sick and had no help from anyone.
But school fees that time we had my age or so one. See, me, I never say I real until you used to condom. I feel that 1 day or 2 years at name once now. I feel if whom you now was not me at the crow.
After that relationship, Jane luckily met another man who would marry her. Few months later, she became pregnant. Jane had to test for HIV in order to protect the unborn child and herself. And that was when reality dawned on her.
I call hospital. I call NSA positive. I call so me father and China worrying to me say, I don't want so be careful. Because go for a shadow give 1 year. You say, Nipa na fe mi huna no jani.
So shadow.
Nipa ko ni.
Okay.
What did you 1 year?
Jane was devastated. Her husband was disturbed and left her to her fate after so much pressure from his family. Jane, at this point, would do anything to get rid of this disease that has been labeled as a killer disease.
I'm called Dr. Brady. I'm called Jane Indro na 6 months still. At the end of that, so
then I'm called Dr. Brady.
I met him TV so. Say Otimisa Sayarian. To me, call na obi so why or the I don't see a paper such as Otimiade Essa. See, OJ, or see over Yentia 45 million. But over 1,005, I'm 1,005. The 1,005 nation, oh baby, are now the 100 cities. Abba. To me, yes, for 6 months. Now the NSO, WMJ.
You know, Ben or the mama.
A droby or I never be drew. I bind the one yamagu a Robin and was silly. And over top a Jenny and a Garrick, you know, Marco 50.
After using the medication for close to 6 months without the expected results, Jane moved to another herbal healer for perhaps more potent treatments.
The giant I say Dr. Mensa. And also me call or on the nedro or more different. A boy how near a war on so a war Ravam 3 times a day.
And your own name or the
And the back could be who say, I say Garrick, but I don't know. One tin papa.
And also, or Joe saying.
And the one jacket, so or say a 28 million already. But what to us say, doing a beer and send that time now for me, shed in this country. It was say 5 million. But no, me no. Now me so tired, bear 2 months, and I'm getting judged.
The desperation to get rid of the stigma associated with living with HIV urged her on. Jane almost lost hope until she saw another advertisement on television that seemed to have found a final solution to her problem.
Me take and not just say, girl now free South Africa no be yeah, you know. We was some for media funds so a boy or more. There's a dear be ampa. And my call the child and me call. See me no me no say panier 100 million or say panier no or what by 1 month maybe through blood to panier and anchor. My mother some copiska about
well, when you scam.
No, send it. They do 100 cities. Me told me, you know, at once one. See, every week be an amicoto. And also 2 months. Rafi, not my arepa, no, my moving na, even. So, see, any time, and giant, and Masakoji, and dry.
Those are excerpts of a Hotline documentary put together by Prince Apia, and that is actually revealing a very alarming trend as far as HIV and AIDS is concerned. I've been joined in the studio by Kojo. He's a pharmacist with the National AIDS Control Program. We'll be engaging him momentarily. We'll also be joined by Dr. Samuel Duncan, a man who's currently researching the disease to find a cure. And also joining us for the discussion will be Dr. Tony Mensah. He's president of the Ghana Association of Medical Herbalists. Some effort, by the way, is already underway to deal with this issue. Listen to the First Lady talk about what she's doing in her own small way.
There has been remarkable progress against HIV with reduction of HIV-related deaths. This notwithstanding, children are still left behind. In 2017, it was estimated that 180,000 new infections among children occurred globally. Majority of these new infections can be found in Africa, with West and Central Africa accounting for 21% of new HIV infections and 30% of global deaths. According to a 2018 UNAIDS report, Ghana had an estimated 3,400 new HIV infections in children under 14 years in 2017. Though this indicates a decline of 42% since 2005, we need to accelerate our response if we have to eliminate HIV infection in children. The good news is there are tried and tested interventions that have demonstrated favorable outcomes. We do not have to do anything new, but deliver these well-known interventions with commitment. We know that a significant number of pregnant women are teenagers, and we do know that teenage pregnancy declines sharply with education. Therefore, interventions among young women to prevent them from contracting HIV will be essential. Improving access to family planning services, girl-child education, and economic empowerment initiatives are likely to reduce age of sexual debut and unplanned pregnancy.
Well, we'll be starting the conversation momentarily. But again, I want you to listen to the Health Minister, Kwekwagyema Menu, who has been talking about what government is doing to tackle the spread of HIV. He was speaking at a press conference this morning.
HIV/AIDS prevention and control. In 2014, the Joint United Nations Program of HIV/AIDS and partners launched the 1990 targets with the aim to diagnose 90% of all HIV-positive persons, provide antiretroviral therapy for 90% of those diagnosed, and achieve viral suppression for 90% of those treated by 2030. This is a big target across the globe, and we'll soon see how we are faring. We should be testing, we should be treating, and we should make sure that we are achieving success by doing viral suppression with the type of treatment that we are giving. This initiative, the 1990, has become a key strategy to end the epidemic by 2030. Let us look at where Ghana stands. In 2016, the first 90 were at 40%. That is for testing. For treatment, we are at 39%, and for viral suppression, 58%. So we were nowhere close to the 1990. 2017, we moved to 62%, 45%, 51%. 2018 December, our statistics indicate 69% for testing, 38% for treatment, and 66% for viral load suppression. We have had challenges with procurement of supplies for treatment, and we have identified this area as an area that we need to improve. So that has become a challenge for us, and we are now adopting a new roadmap to tackle the HIV/AIDS challenge. And we believe that by 2020, we will change these indicators and move closer to achieving the 90 by 2020.
So that is the health minister there talking about what we want to achieve by 2020. Well, the bottom line is the figures don't look good at the moment. Dr. Kojo Kodia Usu is a pharmacist with the National AIDS Control Program. He's here in the studio as I introduced him to you already. Doc, thank you very much for coming.
Thank you.
And I also have here Dr. Anthony Mensah. He's president of the Ghana Association of Medical Herbalists. You're welcome as well.
Thank you very much.
So let's start this conversation, and I don't know why I keep jumping to the next word I want to say before I say it, but that means that also shows you that we keep jumping to the figures we don't want to jump to as far as HIV/AIDS prevalence is concerned. So I have this facts and figures here from the Interest Conference 2014. And I believe that you must be aware of the details that they are. One of the staggering revelations we find here is that the HIV prevalence is rising, especially among particular groups of people, from those who are between 25 and 39-year-olds, men who are having sex with men, and commercial sex workers. Can you elaborate a bit more for us to understand what is happening among these groups?
Well, I'm sure we can understand the fact that HIV is transmitted mainly through sexual activity. Of course, there are other modes of transmission. And you would see that this age group, the
25 to 39,
precisely, are very sexually active.
Okay.
And so in the absence of care in terms of taking precautions, I mean, some of these things are to be expected. Of course, if you take the men who have sex with men, science has proven indeed that the risk of transmission through, I mean, the process of having sex with a man, yes, is, I mean, higher than having sex through the, I don't want to say the normal way, but a man and a woman.
Sex with a woman.
Precisely, precisely. And commercial sex workers, once again, the risk of having sex with multiple partners. And I'm sure you are aware that some clients actually pay to have unprotected sex.
Yeah.
So actually, one would say they pay to have HIV or possibly have, I mean, any other STI. And so this underpins some of the things that you mentioned.
And then there's also the group, the parts of the report that says that more females seems to be newly infected statistics has to do with more females, even though more men are dying of the disease. Try and help us understand that bit.
Yes. Currently, I think about 70% of those estimated to be living with HIV in Ghana are females. More men are dying partly because of the health-seeking behaviors that we have. We often tend to go to the health facility probably when we are, I mean, really feeling it, if I can say that. But women tend to have different health-seeking behavior. One other thing that is helping women is the antenatal clinic. And I believe when it comes to HIV, that is one of the things as a country we do well. Because virtually every pregnant woman in this country is encouraged strongly to take an HIV test. And as a result of that, many of them get to know their status early enough, start taking medications, they maintain their immunity at a very good level and go about their lives, normally without any problem. But many men even don't know their status to be able to even take the necessary steps.
I see. Doc, let me come to you. I'm sure that you're into herbal medicine. I'm sure that you've also seen these figures. And I'm wondering, for those of you in the herbal medicine or medication aspect, how do you, when you see such figures, what comes to mind as far as fighting HIV/AIDS is concerned?
Thank you very much, and let me say a good afternoon to our cherished viewers. Herbal medicines have played very important role in our healthcare delivery system in this country. And as a country, over the years, since the days of the first president of Ghana, we have successive governments have taken measures to ensure that herbal medicine practice is taken seriously. You will recall that in the year 1961, the Osajifo himself led the coming together of practitioners then to form the Ghana Psychic Healers Association. And then in 1975... That's
different from your association, isn't it?
Yes. In fact, our association, the Ghana Association of Medical Herbalists, is the professional body of people who are trained from the university, University of Science and Technology, to be able to diagnose disease conditions and be able to use herbal remedies to, as it were, treat those conditions.
Okay.
But that is not where herbal medicine practice started in this country. I'm saying that in this country, we've taken herbal medicine practice seriously ever since. And we've come a long way. In 1975, there was the establishment of the Center for Scientific Research into Plant Medicine, which is now the Center for Plant Medicine Research. There's been the establishment of the Food and Drugs Authority, which is responsible for registering products, herbal products that are manufactured by practitioners. There is an umbrella body, which is the Ghana Federation of Traditional and Alternative Medicine Practitioners, GAFTRAM. And that umbrella body brings together the indigenous practitioners in order that at least some way, somehow, some level of training could also be given to them. And people who find themselves under that body also do undergo some form of training. But particularly with HIV/AIDS and the intervention that some of the herbalists claim to be able to do, you would find that there are people who do not belong to any of the associations. Of course, they do not belong to our professional association, and they do not also want to associate themselves with even with the federation, that federation of associations that at least would be able to give them that chance to have some level of training. And that is where you have a lot of these challenges coming in. But of course, we are much concerned when the figures are escalating.
I see the way you're linking available medications or research, etc., what we can do with herbal medicine to the prevalence. And I don't know if you agree with that, Doc. I'll come to you to take that thought. But on the phone to join the conversation is Dr. Samolato Duncan. He's the executive president of the Center for Awareness. They are producers of, I don't know if this is COA-FS, which is an immune booster. And we understand that they're also behind the discovery of a potential cure that is still being researched. Doc, thank you for your time this afternoon. How close are you?
Yeah, I'm careful.
No. I mean, how close is the research to help us find a cure?
Oh, actually, research is, hello?
Please go ahead, we can hear you.
Yeah. Research is
we understand that you are already looking into research that could be a potential cure for HIV. Is this correct?
Yes, it's true.
Okay, so tell us how far you have come with the research. Already we know that you're working on, you have this immune booster. And the thing that HIV does essentially is to break down your immune system. But let's talk about the research you're doing about HIV and its cure. We have a representative from the Ghana AIDS Control Program here, so this is a good platform at the moment.
Okay, thank you very much, and let me use this opportunity also to reach your numerous viewers a very good afternoon. Actually, we've gotten to a point where we presented a white paper to the president of Ghana about our findings. You know, research is very expensive, and it cannot be done by just any person, but through proper research hands that are professional. So we've come together, we are into collaboration with Noguchi and Center for Plant Medicine.
Okay.
Yes, and we presented a white paper to the president.
Can you give us a summary of what was in that white paper?
Is it?
What's the summary of what you had in the white paper you presented to the presidency?
Yes. The summary is we have been able to discover a potential cure for HIV. And the government should put together professionals in research to do further studies, conduct further studies on what we have actually found so far, so that they will come out with something that scientifically we can assess a cure or no cure.
Okay.
So this is what we have actually done, because you cannot claim to have cure for HIV unless you have used the international standard protocol set by World Health Organization to prove that. Without that, it is not possible. So we have given it to the president of Ghana and expecting that research hands, that's a professional in research, who conduct
further works into it. Hang on for me, I'll come back to you, Doc. Are you aware of this?
No, but I mean, it's welcome news. One thing we need to realize is that coming out with a medication for use in the population, as we all know, is a long and arduous, process.
Of course, human lives are at stake.
Exactly. Even before you get to the phase 1 trials, where you are allowed to give the medication to a group of carefully selected, healthy people, you would have done a lot of scientific work. You would have done a lot of work in the lab, in tubes, sometimes with animals before you get to the phase 1 trials. And even at that time, you are looking for only the effectiveness in human beings. Before you get to the phase 2, that's where you talk about the effectiveness and so on, and phase 3. And I'm sure recently the malaria vaccine issue, has probably educated us a bit more about the long process we need to go through. So I'm happy that, he's started the process, and I wish him well. In fact, once it goes through, it will be good for the world community, not only this country.
Why not the AIDS control program reach out to people like these and, begin to look into the solutions they are putting on the table?
Like I said, it's great news. So we welcome it, and we usually pass such news on or such information on to the statutory bodies or the bodies that are better placed when it comes to research into some of these things. So we very much welcome it. And actually, if we are to find a cure or any breakthrough into a condition like HIV, it could be huge in terms of even funds flow for the economy and so on. So it's good, but we need to be patient and follow that long process and see. We've gone through this process as a world scientific community for, countless number of formulations.
But I'm just surprised that at the world that we've still not been able to find a solution yet. And so to the herbal medication, you've heard what he says. They've been researching. They've sent to the government some what he's calling a white paper. Is this something you're also aware of?
Yes, I've heard this. This is not the first time I'm hearing of this one. There was a former top scientist with the Noguchi Memorial Institute for Medical Research, who was reappointed by the World Health Organization to supervise polio eradication in Africa. And he made very serious, altercations at the time that he was leaving Noguchi, particularly to do with COAFS. And it is the same thing that the man you spoke with on the phone has reiterated. And I think that the Center of Awareness have taken what right steps there are to take. Things of this nature will require a lot of funding and a lot of, governmental support in order to get it moving. And I think what they have to do is what they have done. It's up to us as a country, since we have always taken herbal medicine development very seriously, this time to take this call even more seriously and to make sure that the right things are done.
So I'm coming back to you, Dr. Duncan. You've sent this document to the presidency. Did you get any response from the presidency?
Not yet.
How long ago did you send it?
Yeah, it was presented to the president on the 19th December 2018.
Okay, so that's just last year.
Through the Chief Justice.
Okay.
And we are here to get instructions for it. But I believe that the government is going to respond positively to it. It is something that's going to help Ghana and the world at large.
What makes you think that this particular discovery you've made, you and your team have made, will necessarily help deal with HIV, a disease we've been trying umpteenth years to get a solution to?
Definitely it's going to make a serious impact. We started the research since 2015, that's 2005. It has been 14 years now. And the record, the data we've collected, points to the direction that within 2 years, Ghana can come out as finding a lasting solution to this HIV problem. And, because I don't want to claim anything, it is only the scientists who can come out convincingly using proper scientific data parameters that, this product can do ABC. But let me clear the air. The product we are talking about is not on the market. It is not a core effort. We have another thing that is not on the market. So we should actually differentiate. There should be a clear distinction between and the research for the cure for HIV that we are presented to the president.
Very well. I believe that has been quite clear. But do you operate in the central region?
Yes.
You operate in the central region. Now, central region is one of the regions where HIV prevalence is really high. Do you know what is happening?
I think I'm happy the government has come up again to fight the HIV menace. And actually, I must actually applaud or give thanks to Ghana AIDS Commission for, had it not been the intervention, I don't think we have reached where we are now. So this is the time all of us have to put our hands together and see the way forward. There were some kind of lapses because of antiretroviral drugs were not available. And because of that, clients were given maybe 1 week in a month. And because of that, that actually has caused the problem because you know that when you default...
What, can you say that again? What has actually spoiled the progress, you say?
Yeah, when there was no antiretroviral drugs, and we know very well that when they actually default, there's, let's say, 2 weeks, 2 days or 3 days, it comes with negative consequences. And that was a time they were even taking 1 week in a month. So the 3 weeks, all the 3 weeks, they were there and they were not taking anything. And that could actually create a very serious problem. And I believe that all those deaths that we've gotten maybe will come from that sort of lack of antiretroviral within the period of time. So this is the time I believe the education must be intensive to make sure that people who are taking their drugs take it well and make sure that they don't default. And whatever we need to do so that people living with HIV will have a long life. Let me end by this saying it is not about what we get out of it. It's about how we're going to help people living with HIV to have a long life. So this should be the concern of all major stakeholders.
Very well.
How they are going to live healthily and peacefully.
Very well, Dr. Samolato Duncan, thank you very much for your time, and I hope that we get to hear more about this research that you've done and the white paper you forwarded to the presidency. Thanks for joining in the conversation. Now let's focus on you two and try and finish it. The central region, apparently, from where he operates, the upper east region, the upper west region, the Volta and the western region seems to be the places where what the report says the recent 5-year ANC prevalence shows an increasing HIV prevalence in these regions. What interventions are you putting in place in these regions, seeing that you know that there's high prevalence, especially in the ANC, to deal with it?
Yeah, so first of all, the key thing is to try and encourage as many of us as possible to test to know our status. Now, once you get to know your status and you start taking medication, and I was very happy Dr. Duncan mentioned the importance of taking antiretroviral medicines and taking them well. Because if you have HIV, you are taking antiretroviral medicines and taking them well. That alone is some sort of prevention, because your immunity increases, the number of copies of viruses in you reduces drastically, and the chances of you passing it on to the next person is greatly reduced, especially if the viral load is down to maybe undetectable. So that is the key, I mean, when it comes to our intervention. And we are encouraging everybody, not only in the regions that you mentioned, everywhere, to, as much as possible, know their status. If you have HIV, no big deal. Just take your antiretroviral medicines and take them well.
Can you mix antiretroviral medicine with herbal medications?
Yeah, currently, there is no registered herbal medicines for treatment or management of HIV.
Not necessarily, but is there something for immune boosting, anything that boosts the immune system?
Surely. If you're looking at the immune system and other, support for the systems when you are on antiretroviral medications, then yes, there are known herbs that will be able to help.
Okay.
But that should not be substituted for, the antiretroviral treatment that you are taking.
I'm saying this because, and I believe that this must have come up in your research, that people, especially in Ghana, there are people who believe it, and I'm using the basis for this point I'm making is the documentary that we've just done. People are most likely to adopt something they believe is herbal, if they believe in herbal medicine, and they want to take that in place of the antiretroviral drugs, because they will say that is obronidro and opebibidro, So I'm just trying to find out if we've perhaps thought about this. Is there a way to combine the two for people living with HIV?
Yes, and like my colleague said, we need to make a distinction. Now, that distinction is, and I believe Jane is the name in the documentary, yes, or Jane. Some other, yes. All the people she went to professed to have a cure.
Yes.
You see, it's not like they had something that could help with some condition she had. And look at it, if you have HIV in the orthodox, sector of the health service, we would talk to you about managing and living positively with the condition such that no one will get to know. But some people, like she unfortunately found out the hard way, would profess to have cure and all that. And out of desperation, people resort to these things, spend a lot of money like she did.
Because it doesn't really make sense, especially when the antiretroviral drugs are free.
Precisely.
What if the problem really is availability? You've had issues with availability, haven't you?
No, I think probably since we started as a country with HIV, with every passing year, availability increases, not only availability as in availability in selected centers. We started back then with, I think, 1 or 2 health facilities. But now, as we speak, we have about 500 health facilities across the country where you can have ARVs. In fact, if you are a pregnant woman, you can have the option of about 2,000 across the country, where you can have them for free. So in terms of access, it's increasing. But I think it's the desperation to sort of clear it from your system. But we need to accept the fact that, as of now, you need to manage it like any other chronic disease, like your hypertension or diabetes. And you'll be able to live positively with it, be able to do everything you need to do without any problem, and live long.
So I'm going to come to you. We can pretend, or not pretend, but we can move on with the conversation and say that, well, these people are quack doctors, they are fake herbalists, etc. They are saying they have the cure, but they don't. But the bottom line is that there are still people who are going to these people. But you have an association that's regulating people who are doing herbal medicine. Is there a plan to reach out to people like the ones that the lady Jane and the others in the documentary reached out to? Do you have a plan, your association, to reach out to these people, bring them under your umbrella and regulate the things that they do?
Okay, as far as regulation is concerned, there is a statutory body that is responsible. We have the Traditional Medicine Practice Council, which is supposed to regulate the practitioner and the premises where they practice. And so if the regulator is up and doing, and of course if the regulator is supported enough to be able to do what they are supposed to do, some of these things should be kept. But to add to what my colleague was saying,
make a quick point there.
Even with the combination of herbs and antiretroviral treatments, it is not for just anybody at all to be able to do, because it comes with a lot of clinical monitoring to check the viral load and other parameters to make sure that, of course, there are no herb-drug interactions happening, etc. Because there's drug-herb
So that wouldn't be an easy intervention.
And that is why it is important that in this day and age, if you would have to assess herbal medicine services, you would look for the right people. If you go to government hospitals across the country, there are places where medical herbalists are at post. And even in some private clinics and herbal clinics and herbal hospitals, there are medical herbalists professionally trained that you can access their services. And so when you go to the place, the law says that they are supposed to, display their registration certificate of the professionals and the premises as having been duly registered. You make sure that you see that the professionals practicing there are certified medical herbalists, and the premises itself is also registered for that services before you put your life in their hands.
Okay, so we've been having this conversation about HIV/AIDS prevalence. We understand that the prevalence is really rising despite all the work that we put, and it looks like many of us went to sleep, and so we're having to come back to this problem and to deal with it as it is. As I shared with you earlier, we understand that the prevalence is rising, especially among persons who are between 25 and 39 years, men who have sex with men, and also commercial sex workers, which is quite obvious. But of course, you need to protect yourself, even if that is the work you want to do. You need to protect yourself. I've been having this conversation with Kojo Kodria. He's a pharmacist with the National AIDS Control Program, and we had Dr. Samuel Ato Duncan, who joined us from Cape Coast. And then we have Dr. Tony Mensah, who's president of the Ghana Association of Medical Herbalists. From the Ghana AIDS Control Program, I just want to give you the final word as to what you can tell people like Jane, people who have rushed or run to herbal, try to embrace herbal medication instead of the antiretrovirals. Just a very, quick 30-second sentence.
Yeah, so all Ghanaians should realize that HIV is no longer a death sentence, obviously. All we need to do is to test for HIV. Once you get to know your status, if you are negative, try and stay negative. But if you are positive, that's not the end of the world. There are medications available. If you take them and adhere to them, you'll be able to live a long and fulfilling life. But you need to test first, know your status, and know what to do.
Know your status and know what to do. So early this year, I checked my status, and we brought you that video. If we should have brought it back to you. I checked my status, and I'm of course negative. My producer wants us to wrap up this conversation, so we're wrapping up right now. But thank you very much for coming. One thing you can do, by the way, when you listen to that song that we used to play, you can maintain one lover. You can wait until marriage. You can use the condom. That is also an available something you can do to protect yourself. But talking about condoms, let me tell you about the health minister's press conference today, at which he revealed that, well, government seems to have bought over 1 million condoms which are defective. Essentially, they've been perforated. Listen.
Close to $3.8 million condoms were imported, procured through Ghana Health Service and the ministry. FDA rejected all of them, so the ministry couldn't take delivery. The contractor is supposed to pay back or replace them, and as at now, that has not happened. So we have referred these matters to Yoko, Attorney General's office, and ourselves are still engaging to see how best we can resolve this matter. Unfortunately, for the condoms, they use Global Fund money. So Global Fund has forced the ministry to pay back that money. And so the person who supplied should get himself ready to refund all that money or replace the condoms for us. Unfortunately, when they were demanding that we should continue to procure condoms to meet our co-funding obligations, some press people reported that the minister had bought $3.9 million condoms. Some of you heard about this. And the minister had no defense in the media. So these are obligations. And we need to work on some of these things. So Central Medical Stores, the effective condoms, case of the 30 ambulances are still work in progress. And I believe we will not throw them away. We'll work diligently on them to see how we can retrieve some monies or get those people involved punished.
Health Minister Kwajima Menu there. Well, you got to believe that $3.9 million worth of condoms, all defective. Do stay safe. Do stay safe and protect yourself from HIV. By all means, just walk to a pharmacy if you need to get a condom. Don't wait for government to provide you one, because as we're hearing, even the ones that we bought are defective.